we know everyone's been affected by COVID-19, but there's been some difference. And so when we look at Latino Hispanics, what we're seeing early on is that the likelihood of infection was higher among Latino Hispanics. I'll explain that in a moment. The likelihood of ending up in the hospital was higher among Latino Hispanics. I'll talk about that in a moment. The likelihood of death was higher among Latino Hispanics. And one thing we know is that COVID-19 has affected life expectancy in our country across the board, but it has affected Latino Hispanics much more than the general population, much more than among white persons, and just slightly less than among Black Americans. But let me go back. Why would Latino Hispanics be more likely to be infected? We're early on in during the pandemic in particular, but still now, Latinos are overrepresented in essential work. In other words, Latino Hispanics, a higher percentage of them are doing the kind of work that was called essential work, whether that's working in a meat packing plant, whether that's working in a supermarket, whether that's working out and about among other people. And so being exposed to other people who might be carrying COVID-19 raises your risk. Now, I also said a higher likelihood of death. So once infected, higher likelihood of death. That's because there are certain medical conditions that have a higher likelihood of being among persons who are Latino Hispanic, including high blood pressure, including type 2 diabetes, including obesity. Yes, obesity is a disease. Every one of those things confers or makes you more likely to have complicated COVID if you were to get COVID. Complicated meaning you could end up in the intensive care unit or you could die. And so why are deaths higher? For precisely the reasons I just said. These underlying medical conditions that raise the likelihood of a complicated COVID, including death.